So I'm going to talk, and I'm going to try to move around. If you don't like something I say, don't ask me a question till the end, but you're welcome to boo, because I'm not going to take offense by it. We talked about this new health care law passed on March 23rd, 2010, named ironically, they love to name it, and it has to be palatable, the Patient Protection and Affordable Care Act. That's a joke, right? Okay, I'm going to try to keep it to 30 minutes. Or if you want me to go on at that point, if they won't shut the lights off, we'll keep going. Implementation time is over 10 years. Okay, we're just going to talk about 2011 changes and what essentially what they're going to bring upon you. The changes coming in 2011, and I got this from the Kaiser Family Foundation website. Kaiser Family Foundation website. I'll list it at the end. You have a copy of my talk, and they're welcome to give that out. The website is www.kff.org, KaiserFamilyFoundation.org. It is a nonpartisan group that basically looks at healthcare spending and healthcare policy and spreads that out for the media, for the general population, and for physicians as well. So, change is coming. So this is what's coming just in 2011. Okay, I'll expand upon some of it, and I'll just gloss over other in details. Kaiser Family Foundation has a wonderful breakdown for you to look at every single year. You can click on it. It's very easy, and I think it's very easy to read. So minimum loss ratio for insurer. We'll go into a little bit more detail later, but I'm just going to go on to I'm just going to be a summary here. Minimum loss ratios for insurance. Closing the Medicare drug coverage gap. Now, as we look at these, remember, I want you to remember, because you're the guy buying the pizza. So the more things I say we're going to give you, and then back end, you're paying for it. Medicare payments for primary care, they're going to go up. Center for Medicare Medication Innovation. Sounds like government redundancy, doesn't it? Medicare premiums for high-income beneficiaries. Medicare prevention benefits, you're going to get more. They'll pay for the prevention. The question is, if you find something, we may not pay for the treatment. Sorry. Medicare Advantage payment changes, they're going to be higher. Medicaid health homes, that's a joke. Chronic disease prevention and Medicaid, yeah. The class program, national quality strategy, changes to tax-free savings accounts. We're still going, just for 2011. Grants to establish wellness programs. I just got bifocals, so I'm trying to. Teaching health centers, medical malpractice grants, funding for health exchange, nutritional labeling, you'll see that this month. Medicaid payments for health, hospital-acquired infections, graduate medical education, Medicare Independent Payment Advisory Board. If you remember anything from tonight's talk, how many people are Medicare? This is the group to watch out for. All presidentially appointed. Average salary, $160,000. I'm not kidding. Medicaid long-term care services. This is where I found my source, the Henry J. Kaiser Family Foundation. It's the source of major parts of my talk. At the bottom, www.kff.org. Sounds like KFC, right? It's a non-profit organization, non-affiliated with Democrats, Republicans, or Tea Party. Okay, minimum medical loss ratio. What does this mean in a nutshell? Essentially, this is that one where they said to the insurance companies, guess what? You're either at the table or you're on the table for lunch. Essentially what they said to them. So they said that, hey, every premium dollar you take in, let's say it's $1, 80% of it has to go towards health care. The other 20% can go towards administrative and your profit. Okay, and of course, unless you're AARP and you sell insurance, okay, because you're sweet and you help push Obamacare, only 65% of your dollars have to go towards health care. You can keep the other 35% profit. Okay. It's on the bottom. Okay. Now, what did they get in return? Remember, you're either at the table for dinner or you're making a deal. What did they get in the deal? they paid several $1 million for Obamacare advertising to support the bill. AARP. AARP is not your friend. Okay, exactly. Closing the Medicare, now this always sounds good. Closing the Medicare drug coverage gap. And who do they hire? They hire the guy from, Maverly, right? Right? Okay? So it requires drug companies to give 50% discount on brand name drugs like Lipitor. How many seniors are on brand name drugs? You're on a majority of generic drugs, right? Okay? So guess what? You only save 10%. Okay? So if you're on a name brand drug, you'll get a 50%. Sounds good. What they push is you get a 50% discount, but not many of you are on a name brand drug. You're on a generic. Okay? And that's only once you hit the donut hole. Okay, what did the drug companies get in return? The drug companies get to keep their brand name drugs patents longer. Everybody gets a deal. Boo, exactly. Medicare payment for primary care doctors, okay? 10% increase in bonus pay for primary care services for primary care doctors to provide primary care services. And also general services practicing in health professional shortage areas. They get an increase. For me, Medicare visits, that would be a small increase. That'd be $10. Okay? Now, who do you think, if I was a primary care doctor, who do you think I would rather take care of? A 26-year-old guy or a girl? Or a Medicare patient that's 80 years old? Who do you think moves through my office quicker? I can see 2 to 3 20-year-old patients than the time it takes me to see a Medicare patient. Okay? That's why people are saying, hey, you know what? I can't afford to take care of them. And this $10, it's a joke, okay? Because my malpractice insurance is going up. You know, I just had a 90-something-year-old patient. Try to take a history off the patient who's 90-something years old, who may have dementia, who the family members don't really know much about their history, their medications, and they want me to try to push that patient through my office in 15 minutes or less. Am I going to provide good medicine? Probably not. Okay. Center for Medicare and Medicaid Innovation, new government entity to test new payment and delivery systems that reduce costs while maintaining improving care. How about global payment for hospital discharge payments? How about global payments for surgeries? Ron talked about that. Let's see, how can we pay less and still demand the same? You'll see later in my talk. Anybody in healthcare? Anybody in healthcare? How about those Medicare patients? Sorry, they got a urinary tract infection in the hospital. We're just not paying for it. Well, how many people believe that people that are older, their immune system just doesn't work as much anymore? Now, if they're in the hospital for congestive heart failure and they're just hardly able to breathe, do you think there's a chance they might develop an infection in the hospital? Or how about if they're dying of cancer? Immune system working good there? Is that my fault that they got a urinary tract infection? But if I'm Medicare and I say, hey, we're just not going to pay for it anymore. That's what's going to happen. They're just going to say, you provide a care, doc, because if you don't, you'll get sued. We're just not going to pay for it anymore. And that's where it's coming. Medicare preventative benefits. Eliminates the copay for Medicare coverage benefits recommended at the level A and B. The U.S. Preventive Services Task Force, blah, 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 blah. Essentially, if you get a mammogram, you get a PSA test, you get a colonoscopy, we're going to take away those copays. Now remember, Medicare and Medicaid still have a lot of unfunded, right? A lot of unfunded. And remember, in the health care bill, they're taking $500 billion out of Medicare. I don't know how it adds up, guys. It's just not adding up to me. Medicare Advantage payment. What is Medicare Advantage? Medicare Advantage is where I was a private insurance company, and I said, you know what? I'm going to try to manage this person's Medicare dollars, okay? They're going to try to phase them out. They're going to phase in payments set at increased smaller percentages for Medicare fee-for-service rates. They're going to freeze the payments at 2011 payments at 2010. So, and one of Obama's friends, they're going to nudge Medicare Advantage kind of out of existence. Just kind of slow. Because if we adjust the water too high, you'll scream. Medicaid health homes, I find this a joke. This is somebody in academic medicine telling me how to practice medicine. Because he gets an hour to see one patient. He's going to tell me how to see them. Doesn't make sense. Create new state Medicaid